have a quick chat, people.
Oh, hang on.
Sorry.
Sorry, Nick, it's already gone.
Okay. Okay, are we rolling?
Yeah, it's rolling now. Everybody's live.
Everybody in, okay. So, well, good morning, everybody. I'm assuming that you can all hear me okay. First things first, this is recording live as of now, streaming on YouTube. But before we get into the crux of the meeting, just a few. So I'm assuming that most of you are now familiar with Zoom. It varies depending on what device you're using. I'm on a laptop, but if you're on an iPad or an iPhone, you'll have different functionalities. Whatever device you're using, can you keep muted unless you're invited to speak by either the chair or the co-chair? And if you wish to address the board, can you, unless you're asked to explicitly, can you raise your hand? So you use the raise your hand symbol in the participants box. I don't know if you've used that. I can see if people are raising their hands, and so can the co-chair. So if you go into, perhaps I'll invite Paul Hanson to tell us how to use it more explicitly. Paul, can you?
Toolbar pop up with some options: mute, stop video, participants. If everyone clicks on the participants button, it will open up a window on the right hand side with a list of everybody's name and then the status of whether they're muted and whether their camera is on. At the bottom of that, you've got an option that says raise hand. If you click on that, a little blue hand will appear.
Thanks. That's hopefully that's clear enough. Well, let's kick off then with the main meeting. We've got the apologies, quite a long list. Kathy Hadley, Matt Golby, Fiona Baker is going to provide an update on the Children's Trust. Teresa Grant, Anna Earnshaw, so Sam Fitzgerald, hopefully Sam is with us joining, I think she is. Joe Watts, replaced by Richard Moore, Nick Hadley, James Andronov was going to join, but he's sent apologies. Darren Dovey, apologies, so Sean Hallam is joining. Nobody from the PCC, Sonia Stewart, Alan Burns should be representing the acutes, and Francis Shattuck from NHS England sends her apologies. Item 2 is notification of requests for members to address the meeting, members of the public to address the meeting. We haven't received any, but I'm sure there will be some people watching live as we speak on YouTube. Item 3 is declarations of interest. So I'd like to invite board members to declare any disclosable pecuniary interest, a DPR or non-statutory disclosable interest with respect to any of the items on the agenda that are not already listed in the register of interests. I'm assuming that there's no response required to that. But if a board member does declare such an interest in either of those two things, they must remove him or herself from the whole of that particular item. And when declaring an interest, board members are asked to state the item number which they have an interest, the nature of the interest, whether the interest is a disclosable pecuniary interest or a non-statutory interest. So hopefully you've all understood loud and clear what that means. We can move on then to item 4, which is the minutes of the meeting on the 9th of January 2020, and I'll invite the board to agree the minutes as a factual record. You can nod, I can see you. Nodding is acceptable. Yep, okay, good, thank you. All looks very good, thank you. So Cheryl, please note that. And item 5 is the action log from the meeting on the 9th of January. And there are a couple of actions. Do I have a hand come up? Yes, I do, David. David, your hand is raised.
Yes, thank you. Can you hear me?
I can hear you.
Thank you. Good morning, everybody. There was an item that Jonathan and I were to discuss around direct payments. We haven't had that conversation yet, but clearly it's something that will be continuing. I can't remember the specific details of it. Obviously, it's a very important issue, and Jonathan and I can pick up on that later on. I'm sorry we haven't had that conversation, but it's not an urgent issue. I don't know if you wish to remove it from the log, and if there's an issue that Jonathan and I come up with, we can bring it back to the board later. Jonathan, does that seem the best to you?
Jonathan, do you want to respond?
Jonathan's putting his thumb up.
Okay, yeah. So just for colleagues in, and people on YouTube. This was Jonathan Ireland and David Jones to discuss personal health budgets outside the meeting. So I think if you can carry on that discussion, David and Jonathan, that'd be very good. Thank you. There's an item for me, an action point to discuss the Administration for Health and Wellbeing Board forums with Lucy Whiteman. This is on hold due to COVID-19, and we'll hear a bit more from Lucy later on in the meeting. Councillor Golby was to provide a presentation on the development of the Children's Trust, but could I invite Councillor Fiona Baker to provide a brief update on the pause and development of the Trust and the appointment of the new Children's Trust Chair, Ian Currier. Fiona.
Thank you. There obviously has been much debate about the Children's Trust moving forward because of the coronavirus situation, and we cannot expect our children's staff to give a lot of time to the Children's Trust at the time when we're trying to keep children as safe as possible and deal with the coronavirus at the same time. So what I have got, which I thought was the best way forward, is a statement which I've got from Lauren Coken, who is the Chief of Staff for the Commissioners at the County Council. They are funding the setup of the Children's Trust. So I thought if she gives us a statement, which I'll read to you, then we'll know exactly how we are at the moment. So forgive me reading from a paper. Due to the impact of COVID-19, the Council has had to understandably divert resources to manage this crisis. This has resulted in a pause in the Trust work. However, work is still going on where possible with the resource we have, such as the chair designate, as you mentioned earlier, Ian Currier, who started last week, the Children's Commissioners team, Mutual Ventures, and our lawyers Burgess Salmon and Bevan Britton. We have agreed with the Chief Executive that work on the Trust will be picked up again when the Council is in the position to release resource back to Trust work. We're hoping this will be June or July. We're still firmly of the view that the Trust is a critical part of service recovery and vital to ensure service stability during the local government reorganisation. We continue to make what progress we can at this point and are committed to launching the Trust as soon as possible, and hopefully in advance of the local government reorganisation currently set for the 1st of April 2021. We have got Ian Currier on board now, and he started last week. So all of those people that the Department of Education are employing, that, for want of a better way of describing them, will be carrying on doing what Trust work they can. It's just that our own staff at NCC, as you can appreciate, are fully involved with the coronavirus and our normal business as usual at the moment. So there is a pause, but certainly not a stop. Thank you.
Okay, thank you, Fiona. Are there any questions from board members for Fiona on that item? Tanzi, your hand is up.
Thank you, Fiona, and fully understand everything within your brief. How can we be assured, though, that children are safe at the moment? Because I know that there is big concern about the hidden situation of safeguarding around vulnerable children.
We are very aware of our vulnerable children that we have at the moment, and every effort is being made to make sure that we are in contact with those children all the time. We have joined forces with the police and district nurses, health visitors, some other health people that are helping us, and schools. Schools have been a vital part of this. A lot of teachers have been helping us with this all over the county, and our records actually for being in touch with our vulnerable children is very high on the national levels. I think we're 11% and the rest of the country is 8%. So we have a lot of children, more children than the rest of the country actually attending school, and those that aren't are probably vulnerable children in a different way to the ones that we easily imagine. We imagine vulnerable children being ones in abusive kind of situations, but vulnerable children are also, as we all know, those with health issues, those with disabilities. And I think quite understandable at the moment that those parents perhaps don't want those children to be in school and catch any virus to add to their difficulties that they have already. So that's an understandable situation, but we're quite confident that with the ones we know of, we are in touch with them at the moment. The difficulty that we will have ongoing is new ones that we don't know of. So we are putting plans in place at the moment to be ready for when this is lifted up and returned to school. We will probably have a bit of an influx of cases that we didn't know about before, which is the issue that we have to deal with.
Thank you, Fiona. Tansy, does that answer your question? Difficult situation for all of us, obviously. Okay, thank you, Tansy. Okay, well, thank you very much for that update, Fiona. That's very helpful. Back to the item 5, actions from the previous meeting of the 9th of January. Ian Morris was to convey. Sorry,
Lucy was waving her hand at you.
Oh, Lucy. Sorry, Lucy. Lucy, over to you. I didn't see you.
That's okay. Morning, everybody. I just wanted to add to Councillor Baker's account. So I know that obviously a lot of our health and SDG members will be aware of the fact that there's been an adult shielded list, and that adult social care have been making every effort to call the thousands of people that are on that. There is also over 1,000, I think, families on a high-risk list in children's, which again, all of the social work teams have been making sure that they ring round so that they are in constant contact with those families that have either been registered as having challenges previously, or that have been identified as high risk for some reason during this period. I just wanted to make sure that people were aware that that was going on as well.
Okay, thank you. Thank you, Lucy. Tansy, you've got your hand up still. Is there anything you wanted to say, or do you need to lower it? Okay, if you could lower it, that would be helpful. Thank you very much indeed. Right, so back to the agenda then. There was a completed item, but just for information, Ian Morris was to convey to the NSAB concerns raised at the board meeting about the rise in incidents of hate crime, both nationally and locally, on ethnic minority staff. I'll say that's completed. Lucy, Peter Lynch and Cheryl Bird were to review the joint NHCP Health and Wellbeing Board Risk Register once the Northamptonshire Healthcare and Wellbeing Plan is published. Again, that's on hold at the moment due to the COVID-19 response. Lucy, I imagine you might want to pick up on that perhaps when you give your COVID response further on in the agenda. If not, no worries. We can move on to item 6. If there's any questions on that, item 6, which is board member updates. I've got a few, and then I'll invite, for those YouTube watchers, individual board members to update us on their organisations and activities. But more generally, congratulations to Simon Weldon, who's been appointed as the Group Chief Executive for Kettering General Hospital and Northampton General Hospital. And following the creation of one CCG for the County of Northamptonshire, NHS Northamptonshire Clinical Commissioning Group became operational from the 1st of April. Dr. Joe Watt has been appointed as chair and will be the CCG chair representative for this board. And as a result, Darren Seeger will no longer be a board member. Darren has been a board member and vice chair since the creation of Health and Wellbeing boards, and he was an original shadow board member back from 2012. He's been very influential in encouraging system-wide integration of health and social care services and setting the future direction of the board. And I've written on behalf of the board to Darren to thank him for his significant contribution. So those are some general points. I'd like to open it up now then to any other board members who wish to update us on activities. I'm looking for hands. A bit like an auction, isn't it? Higher, lower, lower. Whose hands up? Well, I'll tell you what, I'll jump in then, because the University of Northampton have been doing some things which may be of interest to the board. We've been using our estate in a number of ways, working with the NHS as halls of residence for nurses and other activities. But in particular, we've used one of our car parks, Car Park 2, as an assessment centre, COVID-19 assessment centre. So just some numbers on that. Over the last month, or since the 13th of April when it started, up until the 4th of May this month, we've had 177 video consultants, GP consultants activities, and out of those 177 consultations online, 107 individuals were asked by their GP to turn up and to the drive-through centre. And out of those 107, 14 were assessed at the centre and have been were sent to A&E, and mostly at Northampton General. I guess the point about that is that we've been able to prevent people just turning up at A&E feeling unwell through this intervention, which has helped keep some of the pressure off. So we're pleased about that. So we also, the CTC, the Test Centre for Overseas Nurses, is currently closed, but it will reopen hopefully later in June, so we can start to get overseas nurses training again in the UK for work in the NHS. And finally, the podiatry clinic that we run through the university, again, is shut, but there's a big backlog on that. And so we're hoping to start opening the podiatry clinic with social distancing measures sometime towards the end of this month or early June. So that's the update from me. Do we have any others? Yes, Fiona. And I've got Paul White as well. So Fiona Baker.
I was just going to add, Lucy's part that she's already told you about the 1,000 families that we're contacting. But actually, the other thing I was going to add was the fact that we have set up weekly meetings for our children in care and our care leavers for Zoom meetings. And they apparently are going really well. In some ways, I thought they probably seemed better than the meetings we had physically. They seem to be enjoying them exceedingly well, and they're all popping in to join in with us. So we're actually having more children take part in that than we do in the meeting that we call when we go to visit them. But so that's a big success, and they're all enjoying talking to each other, probably mostly. So that is one of our successes. So we, the other thing I wanted to mention was that we are actually still recruiting. We are recruiting foster parents and social workers, and we have had some interest from people who have worked with us in the past and left, and now are looking to come back. So although it's an ongoing battle to recruit social workers, we are actually managing to recruit social workers, and we also are managing to change some of our agency workers into permanent. Maybe the job situation has something to do with that, but that's a good thing.
Yeah, that's very helpful, very interesting. Actually, on the recruitment side, we recruited in April nearly 100 nurses on NHS contracts. That includes midwives and paramedics. So even at the height of COVID, things are still moving in a positive direction, which is good to hear. I've got Paul White. Paul, can you come in on your topic?
Yep, thanks, Nick. I just wanted to give an update on the partnership board. As members may be aware, we suspended the board meetings for March and April to allow the teams of health, not just health, but across the public sector, to focus on addressing the coronavirus challenges. And that has been a tremendous effort by everybody involved, right across the public sector. The level of cooperation, the amount of rapid adaptation we've been able to make has been really quite outstanding. And I'd just like to pay tribute to all the staff that have been involved right across our public services, and indeed in private sector too, in Northants. We will be restarting the board meetings again from this month. Next week will be the first meeting in an adapted form. We're going to have a smaller board, so we allow people to focus on the things that still need to be carried on with COVID. We're now moving into a restoration phase over the next 3 months up to around the end of July. And as a board, we will therefore be narrowing the focus of our agenda and the things we look at to really make those relevant to what we're going through at the moment, and also thinking about the next steps moving forward as we go through restoration into the recovery phase through to the end of the financial year in March and then beyond that. But as everybody knows, it's uncertain territory. We're moving into uncharted waters, mixing metaphors, and we'll just have to play it as we go and adapt. Not just the board, but how the whole system and the structure that's been set up moves forward. But it has been really an outstanding effort to this point, and we want, as a board, to support the moves of the executives, the leaders, the clinicians, and everybody else going forward.
Okay, thank you, Paul. Thanks for that update. Fiona, your hand is still up. Is that you've got something to say, or was that from a previous? Thank you. Sam Fitzgerald. Hello, Sam.
Hi. I just wanted to give you an update from an adult social care perspective. So through this difficult time, we've taken a couple of steps just to make sure that we keep our population safe. So we've made our NAS emergency duty team, so they're now operational 8 AM to 8 PM, 7 days a week. We've also launched a provider hub. So this is a joint initiative between health and social care for our providers. So care homes, domiciliary care, again, that's open 8 till 8, 7 days a week with support, advice, guidance, staff swabbing, access to PPE. Our wider adult social care teams have reviewed our 7,500 customers. We've risk assessed all of those individuals, and we continue to risk assess those individuals who have chosen to reduce or cancel their care. The other thing that we've done is, you may have seen that there was a Care Act easements document that came out. So we've reviewed all of our duties under the Care Act, and we've decided not to enact those easements. Now, as we move forward into kind of phase 2, so we're starting to upscale our business as usual. So we're starting to progress with some of our adult social care transformation work, and then just making sure that we're continuing to go through our pending lists and that we're offering our customers assessments and reviews. So I just really wanted to give the board assurance that adult social care are operational and continuing to serve our population.
That's excellent. Thank you very much, Sam. I'm assuming there's going to be no questions for individuals, but perhaps at the end of this roundup, we can maybe follow up if there are. So can I move on to Sean Hallam?
Yeah, morning all. It was just a quick one for me. Obviously, for a drive of the organisation was responding to appliance availability for us. That was picked up in a HMIC inspection that we had quite a while ago now. As a service, we've been continuously improving that availability. Just before all this lockdown happened, obviously we had a re-inspection around it, and they actually recognised a real significant improvement in what we've got for available. That actually continues all the way through the COVID actually. So we're averaging about 22 appliances at the moment, which is significant improvement from where we were before. And without stealing obviously the conversation that Lucy and Toby are probably going to follow through from the COVID, that enables us to really support then the wider multi-agency response. So it's been positive in the way we can free those resources up if you need to move it forward. So we're in a better position than we were, is the positive bit.
That's good to hear. Thank you, Sean, for that. Alan Burns. Alan, morning. How are you, sir?
Morning. I just thought I'd say a couple of things. Thank you very much for your comments about Simon. He takes over as the Group Chief Executive on the 1st of July.
Right.
And after that, we'll be moving quite quickly to make the other appointments that follow from that. That's the Managing Director of Kettering and the Managing Director of Northampton General, and some of the group appointments, the Group Chief People Officer and the Group Finance Director, and probably the Group Chief Digital Information Officer. One of the things that's come out of COVID is quite what you can achieve with IT. Some of it visible this morning, but hopefully we'll get better at it. I think on the other point, we've sadly had one death in our staff, and that's always a bit of a low point, and the staff were undoubtedly very frightened. And we've had a number of staff who are seriously ill, one of whom still is very seriously ill. On the other hand, as a county, I think we got away in the middle of the pack. We're not the West Midlands, we're not Cumbria, we're not South Essex. On the other hand, we're not Cornwall, and we're not Lincolnshire. So the staff are frightened. So that leads us to the recovery exercise, because there is a big effect on staff. A lot of them have not had days off for quite a long time. And as we go into a slightly easier phase, in inverted commas, we will be trying to give our staff a lot of time off and increasing our allowance for how many of our staff can be off at any one time and so on. So there will be a natural dip from that, partly to prepare them for whatever comes in the winter, partly just because they need the break. That takes us to some of the issues that follow from the recovery, which are just to flag up some of the simple, relatively simple aspects of this. Social distancing is here to stay. So just cast your mind to Kettering or Northampton A&E waiting room. And that's clearly got a bit of a problem attached to it. So we're going to have to think our way very clearly through that. And one of the big issues we want to pursue is outpatient attendances, which we very much hope we can get as many as 80% not happening in the conventional sense. Now that makes life a lot easier on a whole range of fronts: traffic, car parking, social distancing, queuing, patient access, and so on. We're very conscious that people have not been coming to hospital, and some of that's understandable. I mean, fewer accidents, fewer road accidents, fewer all sorts of things. On the other hand, fewer breast lumps is a bit difficult to explain, by 75%. So clearly there's a backlog. Clearly there's going to be a big problem, and we'd be looking for everybody's support, as I'm sure the CCG is, in encouraging people to use the health service, because clearly they're not. The second part of social distancing, I think, in fear is that it's a reasonable probability, not quite clear yet by any stretch of imagination, but a reasonable probability that we'll lose between the two hospitals well over 100 beds because of bed spacing and social distancing in our wards. That's another long-term or immediate problem, depending on how you think about it. And we're going to have to think very carefully about what we use the beds we've got left for, and how we think about priorities. And there's lots of work going on, and we're very pleased that we're restarting the healthcare partnership work, because this will only be solved as a partnership. You know, our job is to try and do the best we can with what we've got without dumping problems on anybody else. And that's an important aspect of it. So I just wanted to flag up a few of the simple practical difficulties, let alone the problems of trying to create safe spaces for cancer care and safe spaces for children. These are going to be very difficult. And I think we all accept, as whatever part of the system we look at here, we all accept that coming out of this well is going to be a heck of a lot harder than going into it. And we really do need to put some serious management effort and leadership into thinking our way through what matters going forward. Thanks.
Thank you, Alan. Just to echo that, I mean, the recovery phase generally is much worse than the crisis phase in terms of its longevity and bashing your head against brick walls. That's what we're hearing from others who've been in similar situations. So I absolutely agree with you, and thank you so much for that update. Perhaps some of the points you've raised there, Alan, will be picked up under item 9 with Lucy's COVID-19 update. Russell Rolfe. Russell, your hand is up. Hello, Russell. You're on mute still. We can come back to you, Russell. Krishni, your hand is up.
Thank you, Nick. I just briefly wanted to comment, follow up Alan's helpful comment about staff recovery, really, because I think, you know, we all need to recognise in addition to all the challenges that Alan has referred to, that there is a staff recovery issue for all health and social care staff, and supporting them through that will be really important. And one of the things that we're working on ourselves to support partners is a staff recovery psychological support offer. So it's really wanted to alert people to that. That is something we're discussing at the moment. Thank you.
It's really helpful. Thank you. Be keen to hear more about that. I'm sure others will as well. Toby Sanders.
Thank you, Nick. Hi there. Nick, just wanted to put a marker down and say there's a number of things I'd like to say in relation to our system's response around COVID, having been heavily and personally involved in leading the system resilience group and other forums over the last couple of months. But just to suggest, perhaps we pick that up under item 9, and if you could bring me in as well as Lucy, that would be appreciated at that point.
Okay, I will do. Thank you very much. Russell, your hand. Are you there, Russell? Russell, calling. Russell Rolfe.
Hello.
Sorry, Russell. Hello, mate.
Sorry about that, everybody. A few technical glitches. So I just wanted to talk about the voluntary sector response, really, largely to COVID-19. We've been conducting some surveys with Northampton-based organisations, and the trends and patterns are quite interesting. Importantly, over 50% of the organisations in Northampton that we've surveyed have said that they still have capacity to help to meet unmet need. The problem they have is a funding issue, quite right, at this moment in time. And equally, 50% are saying that they're at capacity and they can do no more to meet unmet need. The issue for me is that there is lots of external funding out there now directed at the voluntary sector for COVID-19 responses. VIN has managed to gain some of that, but I would welcome having a discussion about what type of unmet need we are really looking at in order to try and access that funding that's available. So I'm not quite sure how that would happen, but I just wanted to throw it out there, really.
Okay, thanks. That's a really good point. I mean, I don't propose we have the discussion right here now on Zoom, but I agree we need to follow it up. Perhaps, Cheryl, we can take that offline and get back to you, Russell, after this meeting. Would that help? I'm sure Tansy and others might have some comments as well that we can circulate around via email and see how that voluntary sector can really get to use its resources in the best way possible. Thank you for raising that, Russell. Unless there's anything else, thank you all for your contributions. It's really encouraging to hear so much great stuff going on around the county, despite the difficult times. And talking of difficult times, item 7, unitary update. Ian Vincent, what's happening?
Right, well, I think the first thing to say is that there's been obviously a huge effort put into the response to the COVID crisis, and that has really reshaped what's going on in terms of the unitarisation. So leaders and chief execs have confirmed that the response to COVID is the top priority. And so everything we're doing towards unitary now has taken a slightly different perspective. So we are scaling down our ambitions for next year. I think the first important thing to say is that the government has revised the structural change order, and that came into effect on the 8th of this month, which following the postponement of the elections due to COVID, actually still expects a two-unitary solution to be put into place in Northamptonshire on the 1st of April next year. So the timetable has not changed. However, obviously, as a group of leaders and chief executives, we are really concerned that we don't really know how long COVID will go on for, what the impacts will be. We've already heard this morning that the restoration phase is often harder and longer than the crisis phase, the action phase. And obviously local authorities are very heavily involved in that, in particularly the economy, but actually getting communities back up and working as well. So that's the backdrop to this. In terms of what happens next, the new structural change order has now brought into legality the setting up of 2 shadow council executives, and they will meet for the first time next month, June. And obviously what their job will be is to bring together all the work that needs to go on to get us across the line on the 1st of April next year in a safe and legal format. We're actually calling our new programme Safe and Legal Plus, because what we don't want to do is lose all the good work that's happened, particularly in adult social care, children's services, with health. So those are two very big spend areas, and so obviously anything that can be done there to maintain the transformation that's already taken place will be a good thing. We've heard from Fiona that the go live date for the Children's Trust is still being attempted before unitary. Again, that will be a challenge, but we're certainly up for that. So this new programme, which actually is being officially launched today, we have revised the prospectus that was the original document that we based the programme we were working on up till this point. That prospectus has been revised to look at particularly some key programme areas. And if I just go through those, and then I'll stop, Nick, that probably bits I will have said enough by then. So obviously the first priority for the new programme is to make sure that, as far as residents are concerned, on the 1st of April, they'll continue to receive the services they are currently receiving in a safe and legal format. So that is really important. The second point is that the new shadow authorities will be set up. They are now go live in effect, and they will be made up of all the members in all the authorities split west and north. So very, very big meetings, and we don't anticipate they'll be meeting that often, but they will be the decision making, give the authority to the two executives. The third point is that we will have, and COVID has certainly had its impact on this, we will have a significant job to do to get two budgets set for the two new authorities, because the money that is actually being spent currently unplanned and only partially funded by government is having a burden on the effect on all 8 councils, but ultimately concentrated into the 2 new councils. So not only will be setting budgets, but we'll also be looking at council tax and all those other awful things that we have to look at, and that will also need to be brought together. So in terms of the programme, what we're trying to do now is bring the district and borough services together into the 2 new unitaries, which is what we were doing before. We recognise that it's almost an impossible task to now completely split county services west and north, and so it's likely that we'll take the view that there'll be a lead authority for some services, and the other unitary will be the lead authority for other services, and they will effectively control and manage the county council's current service workload. The last point, but by no means the least, is that what COVID has done, in my view, is it's actually created, because it's had to, a better reactive working relationship between health and social care. And what we don't want to do in our drive to get to the 1st of April next year is to lose any of that really good work that's been going on. And so we want to take those lessons into the new organisations and not cast them aside because we're hell bent on just getting across the line. I'll stop there. I mean, there's lots of other stuff going on at the moment, but in essence, that's where the new programme is going.
Okay, thank you. Thanks, Ian. Any immediate questions for Ian? Because that was an important and timely update, especially the last point there, which is relevant to both the Partnership Board and the Health and Wellbeing Board, about not losing any integration that's built up over the last few months. David, yes.
In a way, it's difficult, and other colleagues will be involved in more of the conversation than I am. But I'd just like to register, perhaps at this point, an appreciation looking from outside at the partnership working which has been seen. I think over the last 18 months, 2 years, there's been a very significant improvement in relationships, and that is never inevitable. People have put a lot of effort into it. There's been a lot of commitment. And I think that's reflected in the way that we've been able to respond together as a whole county. And certainly I've said publicly, and I'm happy to thank those of you who've been involved. It just feels different. And that from when we joined before, for a whole variety of reasons. And I thank you, Ian, for saying that we must not lose that. We need to see it moving forward and build on those strengthened partnerships. There are other issues to comment, but at this point, both in response to COVID and in the approach that's been taken, much of which I've heard for the first time now, Ian, that feels to me to be pragmatic and realistic in what's a difficult situation over the next few months. Obviously, Health Watch is very closely watching, and I'll come back and comment a bit on some of the COVID stuff that we're beginning to pick up. But that feels encouraging, and thank you very much those of you who made the decision to make it work better, because it was not inevitable.
Yeah, David, well said, very well said. Unless there are other comments for Ian, then immediate comments, we can move on to item 8, which is Lucy Whiteman, Director of Public Health Annual Report. Lucy, over to you, please.
Thank you. Morning again, everybody. So I'm sure you will obviously remember that statutorily each year I'm required to produce a report which basically summarises, for want of a better phrase, the state of the nation. So what are the key challenges around health and wellbeing for Northamptonshire? It's my duty, as I said, to do that, and it is the duty of the Health and Wellbeing Board statutorily to publish it. Obviously, nowadays it's more so a virtual publication than it is a physical publication, but we do always make sure we've got hard copies available. So I'm hoping everybody has seen a copy of this document. I'm hoping as well that you'll see it very much built on last year's document, which talked about the inequalities and obviously focused on what that might look like between the two new unitaries. So this year it's about, well, how do we address the wider determinant issues which tend to be the precursors to those inequalities manifesting themselves, be that economically, within health, around education, or any of the other wider determinants that play into people's life chances. It follows a similar format. I have again included information around the public health finances and a set of key recommendations, as well as providing an update on the work that's been done on last year's recommendations. As I said, this is not a replacement for previous recommendations. It is absolutely a kind of long journey that we go on building upon previous year's work. I am sure people who have had the time to read it, so I appreciate it's not a short document, although I hope you find the way it's laid out and illustrated makes it accessible. It very much is timely because it talks about how we make sure that we make the right decisions and how we consider the health implications of all of the decisions that we make on a day-to-day basis. But obviously, as we've just heard, there are so many decisions that are about to be made, because we've got a new CCG looking at different ways of working, be it because we're going into 2 new unitaries, or because we're still on our journey to developing an integrated care system for Northamptonshire. It's really pertinent that we think about how people live, how well they're educated, their employment chances, etc., how that impacts on health, and that we make sure that we are collective in our conscious decision making around ensuring that people benefit from the decisions that we make. As we go into recovery and restoration, that is probably more important than it ever has been. So, because it's quite a big document, I wanted to open it out to questions more so than me talk any more to the information that's in it.
Okay, that's great. Thank you, Lucy. So we do have a bit of time for questions. Tansy. Hello, Tansy. Tansy, you're muted.
Yep, sorry. Great report, Lucy, and may I congratulate you and the team on really embracing this health for all. I can remember when it started and it was a turgid way of working, but you really now are helping everyone understand that. I think it's more about it's a reflection on the world we knew. That world has been turned upside down, and there are further inequalities being exposed. How are we harnessing the public through, that point you made about working collectively in decision making? That's the leaders, but it's the public activation around that.
So Lucy, do you want to respond?
Yeah, so obviously at the moment we're limited in the amount of direct engagement that we can undertake with the public. But you know that obviously as a set of commissioners, both the Public Health Commissioner but also CCGs, and a lot of our providers are engaging much more in co-design, so that when we are developing services, we're thinking about the public voice, the patient voice, and how people can help us shape the services that we commission and provide. Not only because it did feel initially like it started a little bit like lip service, if I'm being honest, but I think there's a real recognition that actually people can steer us to a much more cost-effective and clinically effective pathway and set of services if we listen to them. Quite often we expect them to conform to a view that we hold about how services should be provided, and then we wonder why they don't access them, or that they're abused or used in a way that they weren't designed. And I think NHST, particularly locally, have led the way in co-design, and we're learning those lessons. So we've certainly undertaken more co-design, and it's, you know, obviously we've talked here about making sure that people are involved and engaged in the decisions that we make. One of the things that we are doing at the moment in public health is undertaking an equality impact assessment around COVID-19 so that we can understand the likely impact it's having on particular groups. Again, so that we can take that into consideration as we start to go into recovery and restoration, to make sure that we are positively discriminating, for want of a better phrase, those people, those geographies, those population groups that have suffered inequities because of the current situation, because we had challenges before around inequalities, but we need to be very, very conscious of how this has potentially widened the gap between some of our demographic groups, and make sure again that they play into how we are best able to provide them with the right support to bring them back up to the same potential opportunities as the rest of the population.
That's great, thank you. Thank you. I've got Jonathan, Ireland and Krishni waiting to come in. Jonathan.
Hi, thanks, Lucy. One question specifically is I'm rather confused about the green spaces in Northamptonshire, which appear to show less green space in the most rural areas. Is that based on parks or something, where you wouldn't have a park in the middle of a countryside village, whereas you would have thought the opposite? Sorry?
Absolutely. So these are green open spaces that belong to, or can sort of, belong to the local authorities and can be controlled in that way. So it's the opportunities that we have as a health and social care system to utilise those spaces. Obviously, there will be things like public rights of way, but quite a lot of our rural areas are actually privately owned land. So we aren't necessarily able to suggest that we can use them in the way that we would want to when we talk about making specific decisions about utilisation and maximisation of opportunities. So these are, like as you say, green spaces that the local authorities own, and that we have the opportunity to further maximise the potential around.
Right. It just looks a bit odd when I'm getting a lot of echo here. There's somebody else got there unmuted.
Yeah, Jonathan, you are echoey. Krishni.
Sorry, there's one more point I wanted to make, if it's all right. I'm going to be slightly controversial here on the whole plan, which I suppose it would do, is based on people exclusively. In our current world environment of global warming, decreasing biodiversity, insect life, bird life, etc., doesn't our health depend on all those things? And if we exclusively deal with people and provide people with these things, we may be destroying the very things that helps our whole ecosystem work, which we in turn depend upon. So I'm slightly concerned that we need to look at ourselves as part of that ecosystem rather than just the people.
I agree, and I'm not quite sure which bits of the report you're referring to that suggests that they're mutually exclusive, but perhaps we haven't made our view that the environment and the way that we interact in it and its health is obviously completely aligned with ours. So apologies if that's come across as two mutually exclusive things. It's absolutely not meant to be the case. In fact, we talk about active travel, reducing pollution, etc., being obviously very, very heavily linked with our physical and mental health.
Okay, thank you. Challenging question, but a good one. Krishni.
Thank you, Chair. Really welcome the report as ever, Lucy. I mean, obviously it's at the centre of, it's at the core of what we need to do as a system, isn't it? Is to address public health and population health issues. I think you've alluded to it, but I did just want to pick up that clearly what COVID has, well, it's certainly brought to the fore is concerns about the disproportionate impact of COVID for whatever reason on our Black and ethnic minority communities. And I think understanding the health inequalities that might underpin that is going to be important for us going forward. appreciate we probably need more data to support that. But it does feel like something we really need to be addressing, because certainly there is quite a lot of talk about, whilst there might be, it's multifactorial, there might be structural inequalities underpinning some of that impact. Thank you.
If I can just come back on that. So people are aware there is a lot of regional and national research going into the disproportionate effects of COVID-19 on Black and ethnic minority groups. It isn't something that we're able to collect data on locally at the kind of granular level that you'd need to be able to undertake local research. So unfortunately, our local public health team haven't been able to provide any insight into that, but it is obviously a recognised issue. And I would be highly surprised if it comes back to say that these inequalities are purely pathophysiological. It has absolutely got to be something to do with the, like you say, the sort of structural inequalities that exist within those groups. So I think it's something that we definitely need to ponder on as we go forward and think about how we can best address some of those challenges.
Thank you. Thanks for a good response, Lucy. David, your hand is up.
Thank you very much. Segueing into the next item, the 19th century learnt that one of the most important ways of improving health and improving the economy was to deal with public health concerns and sanitation and so forth. And COVID, it seems as if we're having to relearn that. The evidence that is coming out about where the virus is most effective. In small rural villages, they are affected by what happens in the crowded urban centres, and picking up Chris's point. So in a way that is underscoring the message that we've been hearing over various years, that the report draws that out. And we just have to deal with that and recognise it somehow. So it's good that we've got the report, we've got the evidence. Thank you, Lucy, for that. But it's a challenge to us in how we think about managing this, because it will require a different sort of approach, and perhaps we have something to learn from the 19th century.
David, thank you. And a good segue then into item 9, which is the COVID-19 update. So I'd like to invite Lucy and Toby to give a verbal update on the COVID-19 situation in Northamptonshire. So Toby, Lucy, floor is yours.
So shall I start, Toby, and then hand over to you? I can give you an update on the sort of epidemiological position, and talk a little bit about what public health is doing, because I've obviously sort of waited to join the two items up now. And then I'll hand over to Toby to talk about what that system response and the CCG has been leading on. Is that okay, Toby? Okay, so most people will know that the Local Resilience Forum, when in a crisis, goes into sort of crisis mode and creates a strategic coordination group. Now, part of the public health response to that would be the creation of a scientific and technical cell, so what's called STAC. So that was stood up very early in the process, and I've been able, because of my joint role, to utilise both the business intelligence function within the CCG and the CSU and my public health analysts to provide an analytical model that provides not only an up-to-date position around the impact of COVID, utilising both activity within the acute primary care activity. It records number of deaths, number of cases, tests taken, etc. But it also has started to model the potential impact over the forthcoming week, and we've been able to break that down by different bed types so that we're able to ascertain and predict when we may end up with some capacity challenges. So for those that join the SCG, you will obviously see this daily update that comes out around midday. So just to give you a quick sort of summary of the main items. Now, I appreciate this is obviously a public forum, and so I'm giving you what is the publicly available data. So people will know that we have locally, undertaken now nearly 2,500 tests. Those have primarily been focused on acute settings and care settings. And within that, we have ended up with roughly 122 new admissions on a day-to-day basis. That's not COVID related. We are now seeing the non-COVID demand step back up. So our acute services are experiencing significant pressure. We have had 1,150 confirmed cases of COVID-19 in Northamptonshire, and sadly we've had 416 deaths. Now, those deaths have primarily been people who we know are more vulnerable to this virus. They are people who are older and who have underlying health conditions. And from a point of view of a sort of a standardised rate compared to other areas in the East Midlands, both our cases and our number of deaths are the middle to the lower end of the scale. Clearly, as somebody mentioned earlier, we're not Lincolnshire, which is very, very rural, and therefore has actually not seen a spread of the virus in the same way. But, you know, our virus spread is focused very much on our conurbations, and therefore, obviously, the pressure continues to be on our acute services. As I said, in the last couple of weeks, we've seen a lot of activity emerging that is non-COVID related, and we are also undertaking a lot of modelling locally with our analytical teams in the acute sector, in NHST, and with some support from some external agencies around what recovery might look like, not only to manage a potential second wave of COVID, but also to make sure that we catch up with some of the demand that obviously has been delayed deliberately from a point of view of elective and planned care, but also some of the delayed issues that may present further down the disease pathway, such as the breast lumps, for example, that Jonathan mentioned earlier. We know that a lot of people have not sought the care that they normally would in a timely fashion, and that itself will generate some latent demand. So that pack is provided on a daily basis. It does also include information about care home outbreaks, about social distancing and social compliance, which is provided in part through things like Google, but also through our LRF partners in the police. And it gives a snapshot of where we are. Just so people are aware, Public Health have also been supporting the Incident Centre in Angel Square. So they've had equal support from the point of view of public health consultants and principals and practitioners. And we are heavily involved in a ethics advisory group, which considers some of the challenges around how we address and prioritise our services under these circumstances. And we also provide a daily update and information and advice around all of the national policy and guidance that's coming out, and we feed into both the PPE and the infection prevention and control cells. So we're pretty busy, we're pretty thinly spread, but hopefully people have been able to see and feel the leadership that Public Health has provided during this time.
Thank you, Lucy. Very clear. Toby.
Yeah, thank you for that, Chair. Nick, I'm conscious of time, so I shall be brief. There are three kind of things I wanted to touch on, just building what others have contributed into today's call already. The first of those is just to say a massive thank you to all of the agencies for how they've stepped up and responded over the last period. I've had the privilege, to be honest, of chairing the Strategic Coordinating Group, which is the multi-agency forum that's coordinated our system response across all agencies over this last period. And the way agencies across the board, public sector agencies, the voluntary sector, community organisations, businesses have stepped into this has just been amazing. So during that initial period, just to give a couple of highlights, you know, the fact that we were able to free up around 400 beds across our 2 acute hospital sites, we were able to roughly double our intensive care capacity should we have needed it. We were able to put in place through particularly the local authorities in the voluntary sector, the support network to the shielded and to the vulnerable populations in terms of both food deliveries and also in terms of medicines. The way that primary care was almost able to completely redesign its delivery model, working primarily remotely and also working in groups in order to provide support to those people who needed physical contact. I could go on, but the response across the board, the role of the fire service in supporting both medicines deliveries and working with EMAS, the role of the military who've been deployed to support us in some of our planning and logistical work, particularly around PPE distribution and delivery. So the whole system has very much turned itself on its head over such a short space of time, and that has been hugely impressive. And I hope that people are aware and see some of the regular newsletters that are put out each week under the hashtag Northants Together banner. If you're not, please let us know and we can make sure those get distributed more widely, because they do summarise and give a much more personal flavour of the response and services that have been put in place. So that was the first thing, just to acknowledge the tremendous response and effort that's been put in place here. We talk a lot about system in health and wellbeing boards and partnership boards, and we really have seen the system pull together in a way like I've never seen in many areas over recent years. The second thing is a little bit more of perhaps a sobering note, and I'll come on to recovery in a moment, but we need to remember that we are absolutely still managing through, and over the next period, we're going to have this ongoing challenge of responding to continued incident and pressure and issues at the same time as thinking about recovery. So as we are here today, we know we still have significant issues around testing capacity. We know our ability to be able to maintain our supply flow on protective personal equipment is pretty finely balanced. We have some real issues in terms of care homes, in terms of both outbreaks and also some wider issues in relation to care home services. And we also know, as we touched earlier on, in terms of some of the safeguarding issues and some of those other dilemmas that will inevitably present themselves as we go further through this and things start to become more visible and more public again. And that's before you get on to the almost inevitability of second and third waves of activity as we start to see the economy and start to see society opening back up again, and the need to maintain capacity to respond to that. And that's important because we're rightly equally focused on restoration now and starting to look at how we re-establish certain core critical services, as well as learning the lessons from the period that we've been through, both in terms of what we've done with services and also how we've worked together to achieve that. But I think our real sort of focus through the strategic coordinating group and our recovery work across the system at the moment is balancing those twin challenges, managing the ongoing incident and situation, which we know will go up and down as we go through this next period, whilst at the same time planning for that restoration and recovery piece, but doing it in a way that maintains the capacity that we need across particularly health and care and other parts of the public sector to still be able to respond to what we know will be further outbreaks and waves as we go through this. So a big thank you from me, but a bit of a balanced message there as well about the opportunity to learn from the way things have been transformed and hold on to that, but equally the inevitability of some of those other pressures and really difficult issues and individual stories that will carry on coming out as we go forwards. Thank you.
That's great. Thank you, Lucy. Thank you, Toby. Any questions or comments, Krishni?
Thank you, Jed. Just a brief comment, really, just to signal that we need to keep in mind that there might be a surge for mental health demand in mental health services as well as acute services, given, I think, feedback throughout the pandemic has suggested the anxiety levels have been raised amongst the general population around response to the pandemic. And we might see that in terms of need for just mental well-being support and demand for more mental health services. So I really just wanted to signal that. Thank you.
Okay, thank you, Krishni. Point well made. David.
Yes, sorry to come back again, but reiterating everything that Toby has said, but some issues that are around. We picked up, we're doing a survey asking for the public's reactions. We've had, I think, 200 responses in the first few days. 50% of those talked about delay getting treatment or intervention, just confirming what colleagues have said, and that will be picking up. Secondly, care homes is a major issue. We've had one or two difficulties. I know things have been reconfigured. Joe Watt was explaining to me yesterday, but this is one of the big issues that in the public debate is going to happen, is going to unfold. And we have to be honest about what has happened. Can I say that I was working in Department of Health on pandemic flu planning in 2006, and I've gone back to look at some of my documents from that time. Everything that has happened now was anticipated over 10 years ago. So national choices have been made about preparedness or not. It's great to see this reaction, but there are issues in there, and the care homes issue is very deeply disturbing. And perhaps I should just say that I've seen today 10 social workers have died, and the exposure of social workers, which is my profession, is an issue. We're going to be talking with CCG, and Joe contacted me and others about the digital movement. There's a lot of learning there, and how does the public respond to that? That's one of the big issues that's coming out, and we're very open to exploring how we can test public reactions to digital issues. Thanks for Lucy and others for the invitation to join the ethics group. It's really good that that is happening. And Sam, it was good to hear the county hasn't implemented the easements. They need to be there, I think, more so in adult care than I think in children's care. But it's good to know that we have the confidence not to enact them at this moment, and people's rights, which is what that's about, rights to assessment, really need to be picked up, and the public are saying to us, that the people that contact us, that that is important to them, so those issues are good. So a lot that is positive, but there are also some challenges we'll be following up over the next few days and weeks. But thanks again to everybody for actually working together in the way Toby described, which was not inevitable and has made a difference. Thank you.
Okay, thanks, David. I can't see any more hands up. When we're getting towards the end of the meeting, Lucy and Toby, thank you so much for that that update. That was excellent. I'm sure we'll hear more of that progress at the next meeting. One just quick comment for Lucy.
Nick's frozen.
Yeah, Nick's frozen, haven't he? It's not just me, is it?
I think we've lost our chair.
Yeah, I think Nick's frozen, isn't he? Yeah.
Yeah, he has. May I just ask one question while I've got the mic? I just needed, because obviously the paper that went out with the DPH annual report does ask for explicit support of the publication. It needs only the board to agree the publication of the DPH annual report, not just obviously to comment on it. So are people happy for that to be published? That's helpful, thank you. So that obviously just needs to be formally recorded, Cheryl, thank you. I think we still have lost Nick, so
Sorry about that. Brief sabbatical. So Lucy, have you got what you need then in terms of feedback? Yes. Okay, that's good. I was just going to sort of wrap up really before any other business, and you maybe name check Alan, Lucy, Toby, Ian, and others. If you think about just a few months ago, all of this notion of integration was a theoretical possibility, something to aim for, and within what 4 or 5 months, it's now become a reality and the new norm. So that's absolutely astonishing. And what it shows to me clearly is that the system, despite what others may say about it, can move quickly and can embrace new ways of working. You know, we've just proved it to ourselves. I think that's actually exciting, despite the backdrop that we're working against, which none of us would have really anticipated or wanted. Also, I think the digital technology, I think Alan Burns mentioned that, and the way we've looked at referrals through the university, through the GP system, you know, moving towards digital really quickly. Look what we're doing now. It's a huge, again, opportunity to almost sort of reprofile what health and wellbeing could be like in the UK post-COVID. So all of that, we can't lose it. Certainly in the integration piece, it's moving at pace, and I think that is encouraging, despite the very awful backdrop that's forcing us to work and behave in these ways. Any other business? I've got one, and that's to ask Richard Moore to introduce himself. Richard, can you do that?
Yes, hi Nick. Apologies, I struggled getting on earlier today. I'm the new lay deputy chair for the CCG, and as you're aware, Jo Watt couldn't make it today, and as part of my induction, she asked if I'd like to sit in. So I just wanted to say hello to everybody. I've met a number of people, but not everybody. So I just wanted to say hello and put minds at rest that there wasn't a spy in the camp this morning. But thank you for letting me take part. It's been really interesting and useful for me.
Good, thank you, Richard. Anybody else for any other business? Looking for hands being raised, nothing coming. So, well, I'd like to thank you all then for a really great session. The next meeting is scheduled for the 9th of July 2020. We'll wait to see whether it's done through social distancing, i.e. Zoom or face-to-face. Probably social distancing will still be in place, I imagine, by then for a large number of us. But thank you very much indeed, and just how impressive it is that the groups across the county are pulling and working so hard together in this really difficult time. So thank you all for the hard work that you do. Have a great rest of the week. Stay safe and see you on the Thursday, the 9th of July, if not before. Thank you very much indeed. Bye.
Thanks, Nick.